It's okay, ma'am. Any issues, madam? Dr. Parveen, you're muted actually. Yeah, now you are unmuted.
Is it clearly visible, ma'am?
Yeah, ma'am, it's absolutely visible. It's fine now.
Okay. Thank you, ma'am.
I think you can start after introduction.
Yes, ma'am. So I think I'm audible to everyone clearly.
Yeah, you're audible. Absolutely.
So moving on to the introductory part, as we all know, as I mentioned before, like in today's world of sedentary lifestyle, the refined food and the stressful mental conditions, means both the somatic and the psychological conditions play a very major role in inducing the metabolic disorders, and dyslipidemia is one among such a global health problem. According to Indian Council of Medical Research report, 37.5% of adults between the age group of 20 to 60 years are being more prevalent or more affected. See, just look at the age group. We do consider from 20 to 45 years is that of the age group where these population can positively give their output or can help for the economical growth of the country. But when such a age group is being affected by these kind of metabolic disorders, then obviously there is drop in the economical growth of the society, which is a major matter of concern. And dyslipidemia holds extreme clinical importance, that is by default and very obvious. So most common cause of the mortality and morbidity, as I before mentioned. So let us understand what is actually the dyslipidemia in brief. Dyslipidemia are the disorders. I cannot say it is one health condition or one health problem. These are a group of disorders of impaired lipoprotein metabolism. See, normally our body undergoes the normal metabolism of carbohydrates, proteins, fats, and the micronutrients as such. One among such is also the lipoprotein metabolism, which normally maintained, the normal health is also maintained. But when there is impaired lipoprotein metabolism, either it might be overproduction or deficiency. So most of the people will be having a confusion that dyslipidemia or increased cholesterol will only be due to overproduction. But do remember, impaired lipoprotein metabolism means it includes both overproduction also, deficiency also. Most common like lipoproteins which we will come across are the chylomicrons, VLDL, LDL, like low density lipoprotein, and the HDL, which will synthesize, process, and meanwhile excrete and hold the major lipid molecules such as cholesterol, triglycerides, and the proteins. So mainly HDL will hold proteins and LDL will hold the cholesterol. Hence, LDL, if it is increased, the cholesterol lipid molecules will also increase. So LDL is considered as the bad cholesterol for the body, whereas HDL is considered as the good cholesterol for the body. This is a well-known fact. And dyslipidemia is clinically characterized by high total cholesterol. These are very important, which has to be laboratorily uh, observed whenever uh, the patient is sent for a laboratory investigation for a lipid profile. So it is marked by high total cholesterol, high low density lipoproteins, high triglycerides, whereas low high density lipoprotein. Moving on to the causes, I can classify the causes, the major causes of dyslipidemia as the primary and the secondary causes. See, why primary and secondary? Because primary are the non-modifiable causes, whereas secondary are the modifiable causes, and we can control or manage them. How? For example, let us see. The primary causes are like inborn derangement of lipid metabolism and transport. So, as the name itself tells, it is inborn derangement. It is present since birth. So, the congenital causes, and if you see the next causes, it is single or multiple gene mutations. So, there is gene mutations, and the ultimate therapy goes with the stem cell or the gene cell therapy, which will be the ultimate correction for the primary causes. But this cannot be possible in the majority of the population. Hence, these are non-modifiable causes. Whereas the secondary causes are modifiable, means we can modify these causes to prevent the dyslipidemia. How? See, hypothyroidism will be the major cause for dyslipidemia. So, if we control or manage hypothyroidism, we can even manage the dyslipidemia. Sedentary lifestyle. If we do the lifestyle changes, we can avoid dyslipidemia. If we manage obesity, diabetes mellitus, alcohol overuse, cigarette smoking, or cholestatic liver disease, then we can even manage dyslipidemia. So these are non-modifiable. And one more important point, what I want to highlight is the drugs, especially the mentioned drugs, thiazides, beta blockers, retinoids, and the glucocorticoids. So, my humble request to everyone here is, if you come across a patient who is on a regular basis of these medicines, like since 2 years, 5 years, or more than that, when you take the treatment history, please do concentrate on these drugs and go for a lipid profile test and do rule out the dyslipidemia, because dyslipidemia is like a silent killer for a person. It goes, as I said, undiagnosed. So please do rule out dyslipidemia when the person is on such medicines. Let us see signs and symptoms. More to signs and symptoms, I can say that these are the clinical manifestations of dyslipidemia. See, I cannot say these are the exact symptoms for dyslipidemia. No. If the condition of dyslipidemia is being left untreated, then it can lead to arousal of these conditions. See, just concentrate on the pictures below. We have planar or the plantar xanthomas, tuberous xanthomas, arcus cornea, eruptive xanthomas. These are nothing but the conditions of a lipid metabolism, extra lipid metabolism over the connective tissues. So whenever the proper metabolism of lipid molecules does not take place, when there is improper excretion or improper metabolism, then there is uh, extra deposition over the connective tissues, and that results in all of these conditions. So whenever you come across these clinical manifestation, do go for ruling out dyslipidemia. Then coming to the major health disorders such as coronary artery disease, peripheral artery disease, and the stroke. The pathology between these conditions is somewhat similar, I can say. That is nothing but the atherosclerosis, where the condition of untreated or unrecognized dyslipidemia eventually leads to buildup of the plaque material, as shown in the picture below here. So the plaque material will uh, get deposited over the inner linings of the blood vessels, regardless whether they are arteries, veins, or the capillaries. Now, this gradual deposition will block the channel of the blood vessels. Now, the blood circulation is being hampered because the channel is being narrowed, and to the next part of the organ, whether it is a heart, whether it is lower limbs, or whether it might be the brain, The next part will get insufficient supply of blood and the oxygen. So when there is deficiency of blood and oxygen supply, obviously that part gets cell death or necrosed, and the person ends up in such conditions like stroke, PAD, or CAD, coronary artery disease. Then one more important thing is acute pancreatitis, which is mostly neglected. So during my clinical experience only, this acute pancreatitis, we do neglect dyslipidemia as a cause for acute pancreatitis. We do not even think that hyperlipidemia or dyslipidemia can become a cause. I'll tell you how it becomes. See, acute pancreatitis is nothing but the inflammation of the pancreatic duct or a pancreas, part of the pancreas. Now, dyslipidemia will release, means the condition of dyslipidemia will release some of the toxins into the pancreatic duct. Now, whenever there is toxin induction in the body, the first and foremost activation in our body are the inflammatory markers. So eventually those toxin buildup will lead to inflammation of the pancreatic duct and part of the pancreas, resulting in acute pancreatitis. So whenever you get a patient or a case of acute pancreatitis, I know you all will think about various infectious agents for causing acute pancreatitis, but my suggestion would be, do think of dyslipidemia as a major cause. It can be hyperlipidemia, hypertriglyceridemia, whatever, but in general, dyslipidemia will become the cause for acute pancreatitis. Hope the points are clear till now. Coming to the interesting, more curious topic, that is how to understand the condition of dyslipidemia in Ayurveda. It was a challenge before few years because dyslipidemia is the condition which cannot be recognized or diagnosed properly, and in Ayurveda laboratory investigations are given the secondary preference. Like we do diagnose the condition based on lakshana, purvarupa, samprapti, uh, and then later we consider as the laboratory investigation for our aid purpose. That's it. But dyslipidemia mainly diagnosed based on laboratory investigations. So how to understand this in Ayurveda is a bit interesting topic. Uh, Whenever I was studying about this topic, so we thought that dyslipidemia cannot be considered to one particular condition in Ayurveda based on the clinical features, based on the pathogenesis, based on the complications, based on the mode of treatment. Dyslipidemia can be considered to various headings which are being mentioned here. The first and foremost thing is Medho Roga. See, Medho Roga, the clear-cut reference we do get in the Madhava Nidana, where Madhavakara mentions in the 34th chapter of Madhava Nidana, like Medho Roga, uh, Nidana, Lakshana, and Samprapti. Initially, and later he explains about the Atisthaulia.
Requesting everyone to mute their mic. Requesting everyone to mute their mics, please. Yeah, madam, you can continue. Sorry for the disturbance.
No problem, no issues. So after Medho Roga, Nidana, Samprapti and Lakshana, he mentions about Atisthaulia, Nidana, Lakshana and Samprapti. Means Madhavakara is giving us a hint that there is slight difference between Medho Roga and Atisthaulia. Moreover, we take both the conditions hand by hand simultaneously, but there is little difference clinically, even pathologically. So that is one thing we need to remember. When it comes to Medho Pradoshaja Vikara, they are the vikaras which are caused due to the improper formation of Medho Dhatu. Like either there might be Medho Vruddhi, Medhas Kshaya, or the Medho Dhatu Rupa Vruddhi or the Rupantara Vruddhi. So this goes in the Amshamshu Kalpana of Samprapti when we study in detail. So all these conditions will come under Medho Pradoshaja Vikara, such as the Prameha Purvarupa and the Ashtanindita. So I want everyone to consider the endocrinal diseases in which the dyslipidemia is being marked very evidently, to consider all these conditions under Medho Pradoshaja Vikara, and the treatment exactly suits like that. Coming to Santarpana Janya Vikara, as the name itself tells, the Vikaras which are developed due to Santarpana Janya Nidana. And Acharya Charaka gives clear-cut reference in Sutrasthana. Means he mentions the Santarpana Nidana, like Aharaja, Viharaja, Manasika, and the Anya Nidana. I'll be explaining in the further slides. Then Medho Vriddhi. So all like Svikstana, Udaralambanam, it is a cardinal feature of Sthaulya. So all those Medho Vriddhi lakshanas can be considered in Medho Vriddhi as a condition linking to dyslipidemia. Next, two very important, very interesting concepts are Shonita Abhishyanda and Dhamani Pratichaya, where we link it to dyslipidemia. So first and foremost thing is Shonita Abhishyanda. See, this might be a new concept or a concept which will be somewhat neglected because of its complexity in understanding. So I just suggest, if we are studying any concept, knowing the word meaning of that concept is very important. That is nothing but Shabdashah Artha. For example, this concept is made up of two words, Shonita and Abhishyanda. So Shonita we do take pertaining to the Rakta Dhatu, and Abhishyanda is Abhishyandana or Abhishyandaha Kleda Karakam we do say. Means where there is extra buildup of Kleda in Rakta Dhatu. For an easy understanding, where the viscosity of the Rakta Dhatu becomes more thicker and thicker. It loses its normal viscosity and it becomes thicker, for an easy understanding. And Shonita Abhishyanda is explained under Viruddhahara concept by Acharya Charaka. So he gives 18 types of Viruddhas, and specifically like fish and milk, if they are taken together, Shonita Abhishyanda develops. Abhishyanda Ahara leading to Shonita Pradushana, and it causes Marga Avarodha. Marga is nothing but the Pantha. It is nothing but Srotas. So any related affected Srotas you can consider over here. See, I have mentioned one of the shloka here. Viruddha Viryatvat Shonita Pradushanaya Maha Abhishyanditvat Margopa Rodhaya. Very clearly mentioned. If you consume Viruddha Virya Ahara, it leads to Shonita Pradushana. Remember, it is not Shonita Prakopa, because Acharya Charaka nowhere mentions Prakopa word for the dhatus or the doshas. He only mentions Prakopa word to the doshas, because doshas will get Prakopa first and they lead to Pradushana or Dushana of the dhatus. So here he mentions Shonita Pradushanaya. It means the dosha prakopa has already occurred, and later it is leading to dhatu pradushana, that is Shonita dhatu pradushana. In what manner? By causing Maha Abhishyandana. Like how the viscosity of the curd will be, because curd is considered as Maha Abhishyandi dravya. So similarly to that, the viscosity of the blood will be, and that type of Shonita will lead to Marga Uparodha. Again, I am telling, it is Uparodha or Avarodha. It is not Avarana. There is a clear-cut difference between Avarana and Avarodha. Here, the Avarana pathology will not come into play. Pathology will come. Okay. So it is just there is one marga, and that is getting obstructed. That itself. It is not getting encapsulated or uncovered by any other things. It is just getting obstructed. So that is the pathology here. And in the next shlokas, he mentions about If the Paushkara, Rohinika, or Kapota, if they are fried in the Sarshapa Taila and consumed with Madhu and Payasya, that leads to Shonita Abhishyanda. In the later stage, it leads to Dhamani Pratichaya. So what we have to understand here means Shonita Abhishyanda and the Dhamani Pratichaya are the sequelae, one after other. So Nidana, I have classified the Nidana as the Aharaja, Viharaja, Manasika, and the Anya. Anya is the Bija Swabhava, which is the primary cause and the non-modifiable cause. Aharaja, Santarpana Janya Ahara, Adhyashana, Ati Sampurna, Guru Madhura Snigdha Abhishyandi Ahara Sevana, which directly leads to the Marga Uparodha. Viharaja like asana sukha, shaya sukha, diva swapna, avyayama, avyavaya. Manasika like achintana, harsha nityatva, manaso nirvrutti, priya darshana. Manaso nirvrutti means not giving any side of psychological stress. You don't do chinta, you'll not be sad, you don't even think, you don't give any sort of work to your manas. So it is manaso nirvrutti. And you start experiencing all the sukhas, praharshanas or the sukhas, like priyadarshana, achintana. So it is nothing but the absolute psychological sedentary lifestyle. So this will lead to the, as before mentioned, either Medho Ruddhi or the Santarpana Janya Vikara or the Dhamani Pratichaya or the Shonita Abhishyanda. Putting in one roof, Santarpana Ahara Vihara will lead to formation of ama. That ama circulates all over the body and it does the dushana of the Medho Dhatu. It causes Shonita Abhishyanda and the Marga Varna. So Marga Varna here, as before I mentioned the pathology of dyslipidemia, which blocks the channels and leads to the cell death or the necrosis of the next coming part. So that conditions can be considered as the Margavarna. See here, I have mentioned Margavarna where the fatal diseases like Vata Vyadhi can develop. Because in this two main important samprapti of Vata Vyadhi we consider as Margasya Avarana and Dhatukshaya. So this can be linked to dyslipidemia. And in this slide, I want to highlight one such disease like Pandu is mentioned as, Pandu Roga is mentioned as the Santarpana Janya Vikara by Acharya Charaka. But in Santarpana Janya Vikara, there is Medho Vruti, obviously, because only the Medho Dhatu is getting nourished. But if you see the Pandu Pratyatma Lakshana, it is Alpa Rakta, Alpa Medas, Nissaraha, Shitilendriyaha. So how come Pandu Roga can be mentioned in Santarpana Janya Vikara? Means the Santarpana Janya Nidana will lead to ama formation. And this ama will not allow other dhatus to get nourished because ama is nothing but apakva adya ahara dhatu, nothing but improperly formed rasa dhatu. So when the first dhatu is only improper, then there is no uttarottara dhatu poshana. But due to tikshnagni and only Medho Dhatvagni activeness, only the Medho Dhatu gets nourished. That is, Medasa Avruta Margatvat Pushyante Anye Na Dhatavaha. Only the Medho Dhatu gets nourished, not the other Dhatus. So there is Alparakta. And there is, the person ends up in Nissara or Avarasara. And the Indriyas will not properly function. That is nothing but Shitilendriya. This is the reason why Acharya Charaka has mentioned Panduroga in Santarpana Janya Vikara. This I wanted to clear. Coming to the Dhamani Pratichaya, how to understand this is, it is mentioned as one of the Kafaja Nanatmaja Vyadhi. Very important point to remember, Kafaja Nanatmaja Vyadhi. And as I said, it is nothing but the sequelae of Shonita Abhishyanta. Like Shonita Abhishyanta, it is very important, sometimes difficult to understand, to diagnose, and it goes left untreated. So it leads to Dhamani Pratichaya. Chakrapani comments like Dhamani Pratichayo, Dhamani Upalepaha. Here, don't just consider Dhamani as the arteries, because Mana Dhamanaha, the one which shows pulsatile movements. Here, I just want you people to broaden your understanding of Dhamani. Please do consider Dhamani as the Sroto mark. So there is upalepana, there is lepa formation along the surfaces of the Sroto marga. That's what Chakrapani wants to say. I have even mentioned below, that is Sroto lepa. If you see Indu commentary on Ashtanga Sangraha, very beautifully explained, upalepa iva upalepaha tad atishayaha. If it goes atishaya, beyond its limitation, or if it becomes too much, then Pratichayaha Atipuranam. The complete Sroto Marga gets Atipurana, gets blocked. That is nothing but entire blockage of the channel or the blood vessel by the plaque formation. So that we do observe in the dyslipidemia. Let us come to treatment approach. I explained the conditions and the samprapti in detail because samprapti vighatana is the main important chikitsa here. And when we come to treatment approach of dyslipidemia, linking to various conditions in Ayurveda, we do have Shodhana, we do have Shamana, we do have Rasayana, Naimittika Rasayana, I want to highlight here. We do have the Hetu Viparita Chikitsa, Hetu Viparitarthakari Chikitsa. Let's go one by one. First thing is Hetu Viparita Chikitsa. We all have been hearing by many people saying that Ayurveda does not treat the symptoms. Ayurveda does not give, a Lakshanika Chikitsa. In emergency conditions, we do have the Lakshanika Chikitsa, obviously, but it is not merely for the treatment of only symptoms. It treats the root cause. So what is that actually treating root cause means? It is nothing but Hetu Viparita Chikitsa. And this sort of chikitsa is being amplified in each and every disease. Let's see what Hetu Viparita Chikitsa in Medho Roga or the Santarpana Janya Vikara. Charaka, again, this goes from the Charaka Samhita. Like, Shastam Ullekhanam Tatra Vireko Rakta Mokshanam Vyayamascha Upavasascha Dhumascha Svedananicha. So first line goes with the Shodhana therapies, where Ullekhana stands for Vamana, Vireko Virechana, and the Rakta Mokshana. Because Rakta Mokshana, why? Because there is the Rakta Shonita Abhishyanta, like Shonita Pradushana. So Rakta Dushti there is. So to eliminate that, we do go for Rakta Mokshana. But I want you people to highlight the Vyayama and Upavasa here. See, there is combined etiology in dyslipidemia. That is nothing but excessive intake and inadequate utilization. Okay. So when such combined etiologies are being observed in the conditions, our approach of treatment must be dual. Like, there is excessive intake, so how our approach should be? It has to be reduced intake. There is inadequate utilization, so our approach should be increased utilization. So our treatment approach should be in that manner. So Vyayama and Upavasa, as mentioned by Charaka, will hold good for this dual approach. How? See, Vyayama does increased utilization. Because Vyayama, like Laghavam, Karma Samartham, Deeptagnir, Medasaha Kshayaha. So Medho Kshaya is being brought out by Vyayama, that is nothing but increased utilization. Upavasa, reduced intake. So this Vyayama and Upavasa will holds good for the combined etiology. So very beautifully explained by Charaka. So this will be the Hetu Viparita Chikitsa. In continuation with this, I want to highlight the Medho Roga and Sthaulya Chikitsa over here. Why? Because both will go hand in hand. So there was a opinion that Medho Roga means only Sthaulya, and Sthaulya is only considered as the Medho Roga. But understanding is being improved as the research works have been done recently. So what he mentions is, again the reference is from Charaka, Sutra 21st chapter, Guru cha atarpanam cheshtam sthulanam karshanam prati. I want you to concentrate on Guru cha atarpanam cheshtam. See, do not get confused with Atarpana and Apatarpana. Charaka very intelligently did not mention Apatarpana. He does not want us to plan Apatarpana Chikitsa in either Medho Roga or Sthaulya, because in both the condition only Medho Dhatu is getting nourished and the other dhatus are not getting nourished. So when there is first of all dhatu kshaya of the other dhatus, if we again do the apatarpana, then it's like we indulging the patient into complications. So he did not mention apatarpana, he told atarpana. And guru ahara, let us see what is guru ahara means. See, guru ahara means in general which is heavy for digestion. So there is uh, agni ruddhi in medho roga or sthaulya. There is agni ruddhi. Why? Because the main culprit in both the conditions is samana vata. So this samana vata, increase in the samana vata will lead to agni sandhukshana. So you cannot give lagu ahara because patient has ati ahara akanksha. You cannot satisfy the sthula person by giving lagu ahara. If you give lagu ahara for every 10 minutes, the person will be eating. And there will be only medho dhatu ruddhi. Hence, instead give him the guru ahara. What happens if you give guru ahara? It will satisfy the ruddha agni. It will satisfy the agni, ruddha agni, and it also does yapana. Yapana is nothing but nourishment. And atarpana means the one which does not cause santarpana. Meanwhile, it does not even cause apatarpana. Atarpanatvacha medo hanti. This is by Chakrapani, where he mentions atarpana drugs should be selected in such a way that they will do medho hanti. Why medho hanti? Because medho dhatu vruddhi is there. Meanwhile, we also have to take care about the ruddha agni. You cannot only concentrate on the medho dhatu and you can't neglect ruddha agni. Hence, very scientifically mentioned, he tells you give guru ahara also, you plan atarpana chikitsa also in the sthula and in the medho roga. So one such beautiful like drug, like explanation of drug is been given by Charaka as well as Sushruta is Madhu. So that too the Purana Madhu, where it has the Rushya, Yapana and the Lekhana karma. Whereas Navina Madhu has the Brahmana karma. We don't want Brahmana here. We want Lekhana, we want Vrushya and the Yapana karma, which is being attained by the Purana Madhu. And also it has the Yogavahi guna. So Yogavahi guna means Vata dosha has this Yogavahi guna, to which dravya it gets mixed. That karma will be done by the Madhu. So which dravya is best for Guru, and atarpana means it is Madhu as mentioned by our acharyas. So after Hetu Viparita Chikitsa, I want to go for Vyadhi Viparita Chikitsa. See, I'm going a bit in detail about the Chikitsa because the Shamanaushadhi, whatever we'll be planning, will depend on the Samprapti and the treatment approach. Because Ayurveda is such a medical science or such a life science, I could say, where it is like the treatment is not for a disease. Okay, you have a headache, take this medicine. Okay, you have a fever, take this medicine. It's not like that. If 5 jwara patients come to me, then my treatment for all 5, like each one of them might be different, because the diagnosis might be same, the diagnosis might be jwara, but the persons are different. So Ayurveda is an individualistic treatment. It is like Purusham, Viksham. We need to do the Vikshan of each and every Purusha, and based on that condition, our treatment approach should be. For this reason, I'm going like regarding Chikitsa in detail. So what Charaka tells is Vatagnani, Annapanani, Shleshma Medho Harani cha, Rukshoshna, Bastastikshna, Rukshani Utvartanani cha. So first let us concentrate on the first line. That is, the Annapana has to be Vatagna, means they have to combat the increased Samana Vata. Also they must be Shleshma Medho Hara. So again, the Trifala and the Madhu, because these will bring about the Vatanulomana and their Shleshma Medho Hara in nature. Next, if you see, Rukshoshna bastayas tikshna rukshani udvartanani. If you see the falashruti or the mode of action of udvartana, Acharya mentions udvartanam kafaharam medasaha pravilayanam. Means udvartana does kafahara by default. And it does the liquefaction of the abadda medas. There are two types of medas, Baddha and Abadda Medas. So, Abadda Medas is getting pravilayana by the Udvartana. So, these Kapha and Medas are taking place in the Samprapti of our Medho Roga, Santarpana Janya or the Sthaulya. So, Udvartana helps in combating that Samprapti Vikatana. Next thing is Bastayas Tikshna, means we have to plan the Tikshna Basti. See, he did not only mention about Basti, he told about Tikshna Basti. When we hear the word Tikshna Basti, two types of Bastis come into mind. The first thing is Lekhana Basti, um, and also the Kshara Basti. If you again see the ingredients of these Bastis, it is Gomutra, Trifala, Haritra, Sarjakshara, Yavakshara, Saindhava Lavana, all have the property of Lekhana or Kava Chedana. So, this Tikshna Basti will combat the avarodha in the Sroto Marga, because these drugs are Sukshma Sroto Gami or Vevai, means these will reach the minutest of the minute channels. That is the reason why Acharya Charaka has mentioned us to plan the Tikshna Basti. Again, while planning the Tikshna Basti, we need to take care about the Agni, because Agni is in the Ruddha Avastha in this Samprapti. So, putting in one roof, Vyadhi Viparita Chikitsa goes with Anta Parimarjana, where the Virukshana, Chedana, Lekhana, Vatagnani, Shleshma Medho Harani. Virukshana is mentioned by Sushruta, because this is mentioned by Charaka. Virukshana mentioned by Sushruta, where Dalhana comments that Virukshanam Medognam, very direct explanation. Anything which is causing internal or the external virukshana, that it is medogna by default. So medogna, it is nothing but the samprapti vighatana for our condition. Bahir parimarjana rukshani udvartanani, as I explained before how the udvartana will lead to medasah pravilayana. So, Vyadhi Viparita Chikitsa, in continuation with that, we do have the drugs like where we plan Takrarishta, Kshara, Swarnamakshika, Kala Loharaja, Shilajatu. So, these are the drugs which dravya which we include whenever we will be planning the Shamanaushadhi in the various conditions which are linked to dyslipidemia in Ayurveda. So we have to make sure that whether we plan the ksharas, with like internal or in the basti preparations, whether we plan rasaushadis, we have to make sure that these contain these dravyas like Shilajatu, Swarnamakshika, Kshara. Even the Swarnamakshika and even the Shilajatu can be planned as an Naimittika Rasayana. So what do we mean by Naimittika Rasayana? There is the Rasayana which is being planned for a Nimitta. Nimitta is nothing but there is one specific reason to plan that Rasayana. What is the specific reason? That is nothing but the disease. So which is the disease here? Dyslipidemia. So Naimittika Rasayana, that is nothing but the Shilajatu. This can be as in Shamana Aushadhi or moreover as a Naimittika Rasayana we can consider. So again, in continuation with this, these are some of the Shamana Aushadhi which we do plan, like Vidangadi Loha, Trayushnadi Loha, Navaka Gugudu, Amrutadya Gugudu, Shiva Gutika, Loharishta, Kola Kulathadi Udvartana, Mahasugandhi Taila Udvartana. Mahasugandhi Taila Udvartana in the sense we take Churna Udvartana, but it will be a Snigdha Udvartana, because all the dyslipidemia patients might not be the Sthaulya. You also get dyslipidemia patients who are Krusha and whose Sharira might be even with like Parushata or the Rukshata. In that conditions, Of course, for the internal pathology of ama and Medho Rupantara Vruddhi, you have to plan Udvartana, but you can again cannot indulge Rukshana. Hence, Mahasugandhi Taila has to be mixed, and that can be a Ishat Snigdha Udvartana, which can be planned, and Erandakshara. So, if you see these drugs, these medications, they contains Triphala, Trikatu, some of the Rasaushadis, Gugulu, even the Shilajatu, Loha. So these are planned in Panduroga as well, because Panduroga is considered as Santarpana Janya Vikara also, where there is Ama formation, and Pandu is also considered as a Bahudosha Vasta. So all these will are beneficial in that conditions. Moving on to Vyadhi Viparitarthakari Chikitsa. So we saw about the Vyadhi Viparita, but it is Viparitarthakari. How means the whatever being the Samprapti, the same quality dravya which are responsible in causing the disease will also act like a treatment for the disease. So it is Viparitarthakari. Like for example, it's my personal experience. Like whenever I eat an ice cream, I do get cold. But meanwhile, if I eat another ice cream, I do get rid of a cold. So I don't know whether it can be considered as Viparitarthakari. Means similar cures the similar. That itself in an easy manner to understand. Let's see. I want to explain this Vyadhi Viparitarthakari Chikitsa with some of the treatment modalities and with the help of few reports. Let us see. The first thing is entitled Effect of Shodhana Sneha on Lipid Profile. So Shodhana Sneha was being planned in the patients whose lipid profile showed the condition of dyslipidemia, and how that affected on the lipid profile before and after the treatment. So let us see what was our intervention. We planned Deepana Pachana with the Chitrakadi Vati 250 mg tablets for 3 days, and a Snehapana with the Gugulu Tiktaka Kruta. 50 ml was the initial or the test dose. Later it was increased, and based on the Agni and Koshta analysis of the patient, the maximum intervened was the 250 ml. This is not a fixed dose. It differs and depends on the Agni and Koshta Bala of the patient. Abhyanga and Bashpa Sveda, later the Virechana was being planned. But here I have highlighted Snehapana. See, excessive consumption of Sneha or the Snigdha Dravya is a cause for Sandarpana Janya Vikara, also the Medho Rogas. If you see the Nidanas mentioned by Madhavakara in the Medho Roga Nidana chapter, he tells Avyayama or Avyayama, Avyavaya, Achintana, and Ati Snigdha Ahara Sevana also. So Sneha Dravya will also come under the Snigdha Dravya, but the Snehapana, during the Snehapana, it was having a positive impact on the lipid profile, means it lowered the lipid profile. Here are the results. So if you can see the first picture of the result over here, effect on triglycerides. The triglycerides, it is before Snehapana and after Snehapana. Initially it was 213, where after the treatment in the sense, after Snehapana we measured it. So it was 176. There was a significant p-value being obtained, and also significant changes or the reduction of triglycerides. Even on the total cholesterol, like 234 of the total cholesterol value became 205 after Snehapana. Even effect on the LDL cholesterol, like low density lipoprotein, it was 146, and it was being reduced eventually. So this was one such condition where the Shodhana Sneha showed a positive in the sense, obviously reducing the increased lipid levels. It means like a positive result in the patient. So it is an example for Vyadhi Viparitarthakari Chikitsa. Next is the Rasayana Prayoga, where I was highlighting the Shilajatu mm, Rasayana as a Naimitika Rasayana. We get a direct reference of Shilajatu Prayogascha sa Agnimanta Rasaha Paraha. Paraha means Shreshta, means in condition of Staulya or the Medho Roga. Shilajatu Prayoga is being considered as the Shreshta one. So we have various rasayanas like Gugudu Rasayana, Shilajatu Loha Rasayana, Trifada Rasayana, even the Lashuna Rasayana. Lashuna Rasayana plays a very important role, like when the dyslipidemia condition is correlated to Shonita Abhishyanda because of its Ushna Tikshna Gunas, it breaks the avarodha of the Marga, hence Lashuna Rasayana has been planned over in those conditions. But we have to also take care about the Agni, because Lashuna is by default Ushna Virya, and because of its Ushnata it has to be combated. Like after the Lashana Rasayana, we used to practice Sadhyo Virechana, like giving a 15 gram of Trivrut Leha, which used to remove the little of Pitta Dushti, what could be caused by the Lashana Rasayana. And Gugudu, Shilajatu, Loha Rasayana. See, Gugudu and Shilajatu Trifada plays a major role. Apart from Medhas and the Kapha Rogas, they are also planned in Unmada, Apasmara, in the Kushta, Panduroga, Ashmari, and Shotha Roga as well. So, if you see the samprapti of all these conditions, there is the avarodha to the marga or the avarana to the sroto marga in one or the other way. So, by seeing their falashruti, it is understood that they will act on the samprapti vighatana. Hence, these rasayanas, what I have mentioned, can be used as a naimitika rasayana. So, this is the thing how like classically planned. Shilajatu and Loha Bhasma. Shilajatu Loha Rasayana. We do get the reference in Chakradatta, not Chakrapani, it is Chakradatta reference, where Shilajatu and Loha is being taken in equal parts, processed with the herbs, and taken in a dose of 2, 1 or half pala, taken for 7, 14 and 21 days. See, this is a classical reference we get in the classics, but practically it might be difficult uh, to follow this pattern. Like we do can plan, but we can start from half pala, and in some patients we stop till 1 pala. We stop till 1 pala. So this is a classical reference where it is being planned like this, taken for 7, 14 and 21 days. So taken in empty stomach, obviously. Shilajatu Loha Rasayana. About the diet restriction, because Acharya tells Varjayet Sarva Kalam tu Kulathan Parivarjayet. Remember, whenever you are planning Shilajatu in a person, whether it can be a Shamana Ushadi or a Rasayana plan, you have to suggest or advise a patient about a strict diet plan to avoid the Kulatha. So this is about Shilajatu Loha Rasayana, which is also known by the term Guru Rasayana. So let us also see some of the research updates which have been done with respect to dyslipidemia or the hyperlipidemia as per understanding in Ayurveda and also the Ayurvedic treatment. First thing is a controlled clinical study evaluating the effect of Shiva Gutika on Shonita Abhishyanda. So the Shonita Abhishyanda condition was taken as hyperlipidemia, and the Shiva Gutika was being planned. Uh, so if you can see the results, there is significant reduction in the total cholesterol levels from 250 to 188, and the triglyceride levels also from 209 to 146. Even you can see the significant reduction in the LDL as well. This is, I think, an animal experiment in high cholesterol diet induced hyperlipidemia in the rabbits, where it was a comparative study of lipid lowering effects of Guggulu and atorvastatin monotherapy in comparison to their combination. Means in first group, it was Gugulu uh, advice. In the next group, it was atorvastatin monotherapy. In the second, it was a combination of both the drugs. But the results, like all the treated groups, showed significant reduction in the lipid profile. So, like each and every the groups where the different uh, medications were advised, they all showed the significant reduction in the lipid profile. So what can we understand by this research work means, when we have such, well, drugs as a rasayana like gugulu, so it is better to avoid the monotherapies like statin group of drugs, because many of the dyslipidemia patients will be, they start the statin group of drugs, atorvastatin. Initially they give, very good results, but eventually there are some side effects of the atorvastatins, so statin group of drugs. Hence, when we have such good drugs which gives a equal results as like statins, so we can go for Ayurvedic treatment of lipid lowering agents such as gugulu. So that is the thing what we have to understand by this research work. So that's all for the session. I think I have conveyed about the Shamana and the Rasayana, and also the condition of dyslipidemia and its understanding in Ayurveda. So if any queries or if any such doubts, we shall discuss it.